Degenerative cervical myelopathy (DCM) is a progressive condition where degeneration of the spinal structures in the neck cervical spine compresses the spinal cord, leading to various neurological impairments. It is the most common cause of spinal cord dysfunction in adults, especially in people over the age of 50. The compression on the spinal cord can result in weakness, numbness, pain, and coordination problems, among other symptoms. Causes of degenerative cervical myelopathy (DCM) occurs due to the wear and tear of the cervical spine as part of the natural aging process, resulting in structural changes that compress the spinal cord. The main degenerative processes include degenerative disc disease. The intervertebral discs between the vertebrae lose water content and shrink over time, leading to reduced flexibility and the formation of bone spurs osteophytes. Cervical spondylosis. This refers to age-related changes in the cervical spine, such as the development of bone spurs, thickening of ligaments, and disc degeneration, all of which contribute to spinal cord compression. Disc herniation. The discs in the spine can bulge or herniate, pressing on the spinal cord or nerve roots. Ligament hypertrophy. The ligaments that support the spine, particularly the ligamentum flavum, may thicken and stiffen over time, further narrowing the space available for the spinal cord. Ossification of the posterior longitudinal ligament (OPLL). The condition where this ligament, which runs along the spinal cord, becomes calcified, causing further compression of the spinal cord. Symptoms of degenerative cervical myelopathy. The symptoms of DCM can vary widely depending on the severity of spinal cord compression and the specific nerves affected. Early signs may be subtle, but as the condition progresses, neurological deficits become more apparent. Common symptoms include neck pain. Pain or stiffness in the neck is often one of the earliest symptoms, though not always present in all cases. Numbness or tingling. Sensory changes, such as numbness, tingling, or a pins and needles sensation in the arms, hands, legs, or feet, are common due to nerve involvement. Weakness. Muscle weakness, particularly in the hands and arms, may develop, making it difficult to perform fine motor tasks like buttoning a shirt or gripping objects. Loss of coordination. Poor balance, difficulty walking, or clumsiness can occur as the spinal cord's control over movement becomes impaired. This is often referred to as gait disturbance. Spasticity. Increased muscle tone or stiffness in the arms or legs may occur, causing difficulty in moving and walking. Bladder or bowel dysfunction. In more advanced cases, spinal cord compression can lead to urinary urgency, incontinence, or bowel control issues. Lhermitte's sign. The sudden electric shock sensation that runs down the spine and into the limbs, triggered by bending the neck forward. Diagnosis of degenerative cervical myelopathy. Early diagnosis is crucial for preventing irreversible damage to the spinal cord. The diagnosis of DCM typically involves a combination of a physical exam, imaging studies, and possibly other tests. Physical and neurological examination. The doctor will assess muscle strength, reflexes, coordination, and sensory function to identify any signs of spinal cord compression. Testing may reveal hyperreflexia, exaggerated reflexes, clonus, involuntary muscle contractions, and a positive Babinski sign, an abnormal reflex response in the foot. Magnetic resonance imaging (MRI). An MRI is the gold standard for diagnosing DCM, as it provides detailed images of the spinal cord, nerves, discs, and surrounding structures. It can reveal the extent of spinal cord compression, disc herniation, ligament thickening, and any other abnormalities. X-rays. X-rays may be taken to assess alignment, bone spurs, or other bony changes in the cervical spine. However, they are less detailed than an MRI. Computed tomography CT scan. A CT scan with myelography injection of contrast dye can be used to visualize the spinal cord and surrounding structures if an MRI is not feasible or provides insufficient detail. Electromyography EMG and nerve conduction studies. These tests can help evaluate the electrical activity of muscles and nerves to assess the extent of nerve damage. Treatment of degenerative cervical myelopathy. The treatment of DCM depends on the severity of the condition, the progression of symptoms, and the impact on quality of life. Non-surgical and surgical treatments are considered based on the individual's case. Non-surgical treatments. Non-surgical management is often considered in cases where symptoms are mild or slow progressing. These treatments aim to reduce symptoms but do not stop the progression of spinal cord damage. Physical therapy. The exercise programs aimed at improving neck mobility, strengthening muscles, and enhancing balance and coordination may help alleviate some symptoms. However, physical therapy is not a cure and is generally limited to managing symptoms. Pain management. Non-steroidal anti-inflammatory drugs and SAIDs or analgesics may be prescribed to manage neck pain and inflammation. Muscle relaxants can help reduce spasticity. Corticosteroid injections may be used to reduce inflammation and pain in some cases, though their benefits for DCM are limited. Lifestyle modifications. Avoiding activities that strain the neck, improving posture, and using supportive devices like neck collars may help reduce symptoms. Surgical treatment. Surgery is often recommended for moderate to severe cases of DCM or when there is clear evidence of spinal cord compression and neurological deficits. The goal of surgery is to decompress the spinal cord, prevent further damage, and potentially improve symptoms. Anterior cervical discectomy and fusion (ACDF). This is one of the most common procedures for treating DCM. It involves removing the degenerated disc or bone spur, pressing on the spinal cord and then fusing the vertebrae together to stabilize the spine. Posterior cervical laminectomy. In this procedure, part of the lamina, the back part of the vertebra, is removed to create more space for the spinal cord, reducing compression. Cervical laminoplasty. Rather than removing the lamina, this procedure involves reshaping or expanding it to relieve pressure on the spinal cord while preserving more of the spine's natural structure. Corpectomy. If more extensive decompression is needed, the corpectomy, removal of part or all of a vertebra, may be performed to relieve spinal cord pressure. This is usually followed by spinal fusion to maintain stability. Recovery and prognosis. The outlook for individuals with DCM largely depends on the severity of spinal cord compression and the timing of intervention. Early surgical treatment generally offers the best chance of preventing further neurological deterioration and improving symptoms. However, complete recovery of function may not always be possible, especially if nerve damage has been long-standing. Post-surgical rehabilitation. Physical therapy is often required after surgery to improve mobility, strength, and function. Long-term monitoring. Even after treatment, individuals with DCM should be monitored for any signs of recurrence or worsening symptoms. Prevention of degenerative cervical myelopathy. While DCM is primarily related to aging and degeneration, certain lifestyle choices may help slow the progression of cervical spine degeneration. Maintain good posture, avoid slouching, and use ergonomic devices, especially during prolonged sitting or computer work. Stay active. Regular exercise, especially activities that strengthen the core and neck muscles, can help maintain spine health. Healthy weight. Maintaining the healthy weight reduces strain on the spine. Avoid smoking. Smoking accelerates the degeneration of spinal discs. Conclusion. Degenerative cervical myelopathy is a serious and progressive condition that can lead to significant neurological deficits if left untreated. Early recognition and diagnosis are crucial for effective treatment. While non-surgical treatments can manage symptoms in mild cases, surgery is often necessary to prevent permanent spinal cord damage in moderate to severe cases. Ongoing care and lifestyle adjustments are key to managing the condition and improving quality of life.